start and we will look at the website together. And in use and updates section, and we can see the some other posts and some other events, and all the course about the with the adaptive orthodontics course with the Dr. Michael Hall is in this post. And here you can take a look at the future plan. And today we are going to do Dr. Hall will mention about how to start it on case with the software, but also he will 2 weeks later, same time, same Tuesday, and he will cover attachments. And after that, he will going to cover 2 weeks later from that, so which is 2nd of November. He will cover printing, 3D printing and aligner fabrication. And lastly, he will do advanced course management and also 21st. And we will do offline course in Sydney. And the course details in this post. And so today, as you can see, we are going to do 4 times of the previous seminar for you to understand what we'll cover and kind of like trailer before the movie. So feel free to contact us to ask about the course and some other options to join, and we're happy to introduce. And before we start, let me briefly look around, show you about the company. We are located in Auburn, and we do have workshops. So we make the digital workshop website, but also you can see all the all these products in our workshop. And we do have ExcelCAD version and also AutoLine software for you to demonstrate, and ExcelPlan. Of course, we can arrange a remote demo with you. And also we do have building center in our place. So as long as you do have scan data, we can design crown together and mill together and furnace together. And also we do have 3D printing. So you can feel free to bring any object or anything you want to design and print together, and we can do it. And also we do have post-processing the devices after 3D printing. And also with the digital workshop, we will provide the aligner manufacturing service, but also 3D printing service and Triconia milling service too. And feel free to ask about the price and also detailed parts. And let's take a look at the post about the course. Now it's time. So even though we, I guess it's better to start right now, right? Okay. And once again, this is a topics, and you can visit our website to see what will be the future topics with Dr. Michael Hall. And before we start, let me introduce Dr. Michael Hall. Here. Dr. Michael Hall has been practicing dentistry for over 3 decades after receiving his Bachelor of Dental Science from University of Sydney. Dr. Hall began practicing in NSW in 1991. Although Dr. Hall is experienced in all aspects of dentistry, has a special interest in new dental technology, short-term orthodontics, dental implants, lasers, and cosmetic dentistry. He believes strongly in continuing education and is also a clinical trainer for dental implant and CAD/CAM technology in Australia. And now I'm going to stop sharing my screen, and I will pass the control to Dr. Michael Hall. Dr. Hall?
Hello, hi. You got me?
Yes, I can hear you. We can see you.
Welcome, everybody. I'm going to go straight into this. The linchpin of our in-house aligner system is this program called AutoLine. Autoline is the program that allows you to take a model, digital model, and then move teeth with it. It is the main body of the whole project. Now I'm going to skip straight to that program. Hopefully you see that program now. Is that correct? All right. I'm going to skip to a case, and I will skip straight into where the model is already done. The pre-preparation scan and all that is something that we'll do face to face. So I'll take you straight to the program and show you when it comes into your program. This is kind of what it looks like. Okay. And we can do a few things with this. When we first get it, we do orientation. I will really quickly, as I'm talking, just go through and show you the process of me doing this. And reorientation, when you get the program first in, it may not be aligned, you can align it. So it's kind of like you in the analog world mounting this on an articulator, making sure everything is straight, because when it's straight, the reference points that we're going to use later on is based on this. Right? Don't go for any details. I just want you to know, get a feel of the power of this program, how the tools are there, so we can align all this in 3D space to help us later on in doing what we got to do. Okay, on the front, yeah, that looks about square. Aligning it, put the model back on again. Okay, we're happy with that. You can actually, if it was missed for some reason, wrongly articulated, you can actually just move the upper one relative to the bottom one, and you can check the occlusion. Really, in this day and age, I don't do very many analog work anymore. Everything's done like this. Everything is done digitally. All right, skip to this part. So you get the idea being that we can orientate, the model comes in, whatever orientation, you can then fine tune it. As is in the analog real world, you want to create a base. I will create a base very quickly for you. For those of you who are comparing this to other system you may have been exposed to, I'll just show you how quickly we can do this here. So we've poured the model and we've based it. A lot cleaner than doing it in the lab with plaster. The pre-processing that I referred to before, that I've done before coming here, is to do with blocking the undercuts. Clearly, if you're putting sequential aligners in, you need to block undercuts. That's part of the course, and not an unimportant part, just not very interesting. So I'm skipping straight to the interesting part. So here's the base, and this is the model. What's that? Maybe 2 minutes worth of work. We're now ready to start work. Okay, so the first thing to do is go into segmentation. The program is well designed in that you go on the top bar here and you work from left to right. Okay, and then with each of the tags on the top that you see, you work down any work you have on your left tabulation map. So we've gone from getting the data to the view, the orientation. Now we're doing segmentation. Segmentation, as the name suggests, is us telling the program which tooth is what. So if you start on this one here, segmentation of the maxilla, right? Set medial to distal, and you go mesial, distal, mesial, and it says from left to right. It's assumed that the wisdom teeth are going to start with. We'll click this and say, no, you can start from 1-8, and then you go, etc., etc. I'm going to do one arch manually. I've already skipped the finish, but I'll just show you how fast this is. Just do one arch. 2, 1, 2, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6, 2, 7. and you say contour. It'll now attempt to draw a line around each tooth. And it did a pretty good job. Say this one here is not so good. We can actually go there and start manually doing this one. And there's very little of this to do. And that's it. Okay, and you go refine this. You get to be very good at this. And then before you move on to finishing this, you have to show the align the axis. Very quickly done. Okay, in each one of these. That's pretty good. You might, and I'm being fussy here a little bit, but I'm also trying to show off how fast this thing is. So I'm just going to do the gross bits. Long axis, the buckle line, etc., etc. You still get the idea. This part here is important in as much as it makes it easier for you to align the tooth later on. Now, once this is all done for the top and the bottom, and I'm going to skip this part because I've done it, and I'm going to go back to my version here, same case, which I already did the segmentation. And so this is what it's going to look like. Each tooth is now individually segmented. Okay, all the tooth axis has been shown. Okay, and all the axes have been shown. So it's now ready for us to do the fun part, which is go, as I said before, as you travel the top bar from view, segmentation, now we go to three-dimensional 3D setup. And we're going to do a case, this case right now, right in front of you, a new case setup. Occlusal plane, the arch, we can pick the arch form. This is pretty good, maybe. I'll say pick this arch form here. We'll go into the details later. I'm going to pick an arch form. This is the guide, the map we're going to work with. So the arch form might want to be a bit narrower, wider. This is nearly there. This is the best fit line they're going to have. Right, then we go to tooth setup. And let's have some fun. Let's have some fun. So this is a class 1 case, but it's funny. Okay, let's just say I'm interested in this case, this tooth there. I am going to try to correct this div 1 and div 2 by retroclining this tooth a little bit. What else am I going to do? This tooth is a bit tucked in. This one is a bit tucked out. Let's just do this very quickly. There's a little bit of crowding at the bottom. Okay, so how do we do this? Very simply, click on the tooth you're working on. I'm using the alignment there of the arch, which I've set as my guide, as the first point of reference. Okay, go back to the double arch and say, yeah, we did pretty good there. What about this one here? Maybe you want to bring this, tuck this down a little bit. Maybe you want to tuck this one out a little bit. So in the course, the way I'm navigating now is something that will become very second nature to you. We'll teach you how to do that very quickly. So let's now just concentrate on the upper arch. And that rotation might be a little bit out. We want to correct that. We'll correct that. And also, for those of you like me, when I drive nowadays, there's this cruise control, and I want to drive digitally. I want to say, I want to set the speed that I want to go to. Digital control is much easier, but slower. So this little button here gives you the digital control for each of these two. And from here, instead of analog and sliding this, I can rotate it by number. Okay, I can do a tour. Now, I won't show you the details, but I'm going to talk these teeth. Okay, I'm going to talk this teeth so that you're not going to appreciate the talk. I'm going to put it up here, and you can see if I do it here, if I talk this teeth, not rotate, sorry, talk the roots backwards, this one here as well. And I torqued it to 6 degrees. I'm going to do the same here. Just over 6, maybe 7. I'll do the same here. And I'm addressing the overjet. And I kind of done all I want to do with this case. It is a minor case. This is a retreatment case or refinement case. Many years ago, this patient has had braces. We just want to say, oh, it's relapsed slightly. And I've corrected it. That's all I want to do. Okay. I mean, I can do more. This is just, again, to show off how fast. This is a real case, which I'm going to present in a few weeks. So I'll play with the refinement later on. But overall, what I've done was just broad stroke, put everything down, do the analysis, and think, well, that can still work, right? Within limits, which we'll teach you all about that during the course. Okay, let's just say okay to that and show you the next part. You can do a lot more refinement. This tooth can be uprighted there a little bit. Let's just say, okay, look, this eye tooth doesn't look right. You want to go back and do something about that? Let's do so. Edit. That tooth there needs to be uprighted a little bit. That looks better. Maybe this one too. Okay, that'll do. Okay. I am kind of rushing this a bit. You can play with this as much as you like. Uprighting this, uprighting that. All right, you're gonna have to excuse me. I'm really annoyed at what I'm looking at the moment. Just give me 1 second. It doesn't take that long. All right, this here is not. Yeah, that one is just. You can do whatever you like instead of talking to a third party through a bloody internet conversation or a, Invisalign correspondence, writing to and from. You do it yourself, direct control, and that's what you got. Now I'm happy with that. Now I'm happy to just even play with it. I can just let it go now, and get an idea. I'll go to the model art, which is again next tab along on the top horizontal, and I want to just get an idea, even with what I've done so far, very quickly. How many steps does it take? The steps, set up already as a default, but you can change that to your liking, right? 0.3 of a millimeter each step of the tray. These parameters are pretty right. I've kind of looked at them, researched them. They're pretty right on to what current trends are, research are in the movement of teeth. But it's only an average. As you can imagine, everybody's teeth will move differently. That's why sometimes you will have a little bit of relapse, or you have to stay in your tray for just a little bit longer. But for the average, this is very good. So it's telling me that for what I've done, I've clicked through, I will need a total of 9 trays on the maxilla and 20 trays on the bottom. Really, I did a lot more work in the top, but it only gives me 9 trays. Okay, so that will then generate a number of trays for me. You can look at all of these steps individually. Many tools to work with. Step 1, step 2. So boring to look at. Okay, I'm going to just go back quickly to the previous function and show you how I actually do this analysis when I'm finished with it. There's a video tool here. Sorry to skip back on you. but I like this tool better, where I can run through this either slowly like this. You see the changes? Or I just run through it really quickly. And in presenting to my patient, I usually do this case and show them, yeah, this is what I want to do. And then they appreciate how much work there is to be done and what the changes are. Please remember, I'm doing this very quickly, and there's there's fine tuning here to be had. Again, it doesn't take much longer to do so. And when I skip the model phase, the program now actually sets up each step according to those parameters I had before. Okay, and again, based on the reports here, it only makes sense for me to go backwards here. Anyway, the reports here are showing you, PDF report to show you how, say, in the maxilla, for each of the tooth, how much, for instance, rotation there is on the 1-3. This is where I go through and analyze anything above 5, anything above 5 in the rotation, for instance. I'm just concentrating on rotation. This is part of the course, right? Anything above 5 in the rotation, I mark down. Later on, I will use this report to determine where all my attachments are going to go. Anything about near 1 in the tooth movement, or above half for me, like this one here, there's a huge movement, I will put attachments, right? 1-4 has no movement at all, no attachment, no attachments. Rotation, rotation. These reports are what I will use later on to determine where my buttons are going to be placed. In any case, I skip now. So when I come to here and I remembered that, oh yeah, that's right, I need to put a button, a rotation button here, or a torque button here. Because I know when you go from number 9 to 0, see what moves a lot? This one moves a lot. So I'm going to put an attachment here, and that one, and I will teach you, during the course, teach you how to design your buttons. There is not one answer. Nobody all has the one answer for everything, but I have a strategy that I use as well. So this tooth has to be I need this tooth to move. And this will have be a button there. And this is the design for a rotation and extrusion. All right, so this is not a forum for me to go through and to show you exactly the tools and exactly what I want to do, but you get the idea, right? If you're familiar with Invisalign, you will know all the tools, all the functions, they're all here, right? Or something very similar. And the concepts are all very same. I borrow a lot of their concepts as well. But you have the, once you understand what you're doing, you have the ability to design, change. Yeah, nothing's one size fits all, and this is the ability to do it yourself. Here, you can actually design the width exactly what you want it to be. The concept of buttons is I spend a lot of time to go through with you guys. Rotations are supposed to be very hard, and I think they are, but I think the tools are strong enough, powerful enough for us to be able to do that quite easily. See how this one flipped up? Okay, you can actually even put an attachment on the inside. Okay. Etc. etc. Okay, so when I do this stage of the game, I will have my PDF on paper, either printed on a secondary screen, which I actually work with secondary screens, and just step through them with that PDF that I had before, right? And go through and search the 1-3, that's the one. I did the 1-8. What else is there? 1-2, 2, and methodically go through, right, and mark all those teeth with the attachments required. Here, it looks as if there are 1, 2, 3, 4, 5, 6 teeth in these attachments. Okay, of course, there are priorities. Again, I borrowed that from established cases, which is more important, translation first or rotation first. In fact, I believe that rotation and translation can be done together, and I have a certain protocol for that. Extraction protocol, if you are doing force and retracting, there are certain protocols which are well established within Invisalign. We'll borrow that idea from them as well. And that's the way you finish this case. Put all the buttons in. Buttons are important. If the main body is this program, the buttons, the attachments are the skeleton of this whole process. You really need the buttons to be well designed, and it's something I spent a bit of time on to teach you how to use this or to apply this procedure. On a more practical, logistical thing is that when you finish with this, you have to label this. If you ever wonder how, because we don't have a laser printer to print on this, we can actually then, for this one, is label emboss the details in here. And this is the X, Y, Z, patient name. And X, Y, Z is there. Right. So can you imagine that then in a tray, it comes out and it actually says X, Y, Z there. You can actually then say which tray this is as well. That's the one actually I use. And because it's there, when you make the tray, it'll be embossed into the tray. If that makes any sense. Okay. So in short, very, very quickly, I don't know how much time it was, about half an hour, right? I have designed and got this case to the point where I can now take it to the printer and print it. This is not a very interesting case, so I'm going to quickly go through it. I show you the power of the program using a different case, which is a nightmare case. It's a class 3. It's a class 3 skeletal case. Unilateral, crossbite. What can we do with this one? Well, we can extract the 4-1. So here's a scenario where I extracted the 4-1 and I finished it in this manner. Yeah, it's not bad. Okay, well, what if we try extracting from here the premolar, the 4-4 set? Here's the setup for the 4-4. Okay, so I've gone through, this is again a real case, a live case, and I've gone through all the scenario where I can extract the tooth, and the tools are there, very straightforward, right? And I've extracted the 4-4, I extracted the 4-1, then I thought maybe we can extract the 3-1. So if you're looking down here, I'm on the upper left of the screen there. I'm going to extract 3-1, and it's a different finish, right? I can extract the molar. and do analysis there. I didn't quite finish this one because I think I decided at the end extracting the 4.7 was there's a lot more anchorage issue here. These are more advanced things you can do with this. The patient, however, sorry, there you go. That's the 4.7 one. You can also do these things in layers, in stages, right? I want to extract the 4.7, and the first thing I wanted to do was actually push these things back before I use the anchorage to pull everything backwards. Then in the stage 2, I want to do this. So you can stage. This program allows staging, which is an important feature of this kind of program. And so it's like being a traffic controller and saying which teeth can go first. So the program allows you to stage. All right, so I'm showing off a feature of this program. It allows you to stage. And the patient does not want extraction. It's really dead scared of extraction. What I tried non-extraction, and it's lousy. You know why it's lousy? Because when you do this to it, okay, the amount of this is ridiculous, this overlap. The amount of interproximal reduction that was required, I calculated. It is an extraction case for sure. There was no, I said, I'm going to have to peel so much tooth of the case, you might as well extract. So she has to kind of suck it up and go see a specialist and be put under to remove just a single one tooth. Now, I haven't decided which one to do yet because I wasn't sure whether I could convince this patient to have an extraction, but I think I have to, because after all the analysis I've done, the non-extraction case is the worst one, it's the hardest one. When you go to the modeler, it takes such a long time. The 4.7 extraction case took the most amount of trays, too long. This one's 3.1's okay, 4.1's okay, 4.4 is actually something in between, which is good. Now, again, you've done this with Invisalign before. I don't know how many times you can, how many scenarios you can test, but it takes so long to and from, right? This one took me, a couple of hours of and ahhing, click, and playing with it. And this case is well analyzed. So I might switch to some logistical approach to show you why doing this case like this, it is better for us. Financially speaking, everybody asked me this question previously, how much time does it take to do this? On the academic side, I'll say to you, you get better control, you'll get a better result using this method. But if you, because it's directly in your control, because you can turn around things very, very quickly and you can react. It's very responsive. Now, if that's not enough for you, let's then talk about the money side of things. Kevin, I hope I'm looking at the right slides now. Have I switched?
We can see presenters view now.
Okay, wrong one. This is my, sorry, that's right.
Yeah, switching.
This one.
Now it's very good.
All right. So to do the cost analysis, it's easy. We can just do a benchmark with the benchmark lab, which is of course Invisalign, right? But let's look now first at the breakdown. Now, the most important thing to realize when we do this, I'll come back to this slide actually. This is not the slide I want to see first. This is the slide I want to see. If required, I can actually turn around a case overnight, right? Scanning now with the new generation scanner, both arches can be done in like 5 minutes. It's actually about 2 minutes, a minute and a half each arch. In 5 minutes, is rounding it up a little bit. So double that, 10 minutes, big deal, right? It really is. It couldn't take you more than 10 minutes. With a bit of practice, it is 5 minutes. Pre-processing, which I didn't show you, takes about 5 minutes per arch. That's actually quite an important part to do, where you pre-process the arch. It's basically like blocking undercuts, making sure the bubbles, anything that's there is fixed in the analog equivalent. And autoline is what I just did before, 30 minutes. This I'm kind of averaging. There are cases that will take you less time, there's cases that will take you more time. Maybe 30 minutes on a low end, but because segmentation should take you about 10 minutes. But those cases that I'm alluding to, they will take you 30 minutes, tons, a myriad of them, which I'll allude to you later. There are so many little cases that we don't even think about doing because the lab fee within Invisalign is so prohibitive that it just, you don't even ask. Now, since doing this in-house, every case that comes in has a little bit of, misalignment, a little bit, toss it out. Hey, do you want to fix that? Oh, yeah, it's too expensive. So, no, it's not. It's this much. And you go, what? Because it's no longer Invisalign, and you can make money charging a significantly lower fee and a fair fee. Okay, so this processing time, the whole thing should take about 100, just over an hour and a half, say 2 hours max, to turn around the case to the point that you actually produce a tray and deliver the case, if you need to. That's very different. Now, if you look at the comparative fee, okay, there are 4 tiers in the lab fees with Invisalign. Okay, and the Express, which is the lowest one, there are the one single arch and double arch. You notice that single arch is not half the cost of double arch, as you can imagine. From 1 to 7 trays, it costs the same. Clearly, you don't want to do 1 tray because it's just too damn expensive. At 7 trays for each level, at the highest end of the range, it's the cheapest. Okay, so you can imagine if you do 7 trays and a dual arch, that will be the least amount of money you'll pay for this Express. With Light, if you do 8 trays, you're going to pay more money per tray than if you're going to pay 7, clearly, etc., for each case. Now, as you go up, it's capped, but it's also, even if it's only 1 arch, it's the same fee. So it's not cheaper if you do 1 arch only, but if it's more than 26. Okay, so let's break this down a little bit to see in a spreadsheet. Oh, before I go there, the importance of those little cases, the Express cases, is that there are so many of them right in front of you, which we don't even touch because we know how much it costs to do Invisalign. We don't go there because we can't charge enough to attract any people, any takers, any of our patients to do it. And that's where those people like Smile Club comes in, right? They charge a flat fee. They say cut out the middleman, implying us, the dentist, and then as if this kind of cases can be done without proper dental care. Now, if you believe that, then you're not in the right place here, because we do work here. We actually do it properly here. If it's so simple that you just sending to Invisalign and just getting some lab technician to do it for you and bring it back and say, oh yeah, okay, let's go ahead, then the Smile Club is correct. They can cut out the middleman. But I put it to you that if we do the cases as we should be done by a dentist and work within biological limits, which is safer, and then we take care of patient compliance, it is a better service. We can do so. We can provide it at a competitive price, even against the likes of Smile Direct or Smile Club. All right, 65%. Well, I know these are American figures. I couldn't find an Australian one. Well, we're very similar, right? 65%. There's so many of these cases. And I've found that to be true in the last year and a half as I've been doing this in-house production, fabrication of trays. I've been able to provide those cases treatment at a fair fee, and it's actually in this time of the COVID crisis, I'm actually quite booming in this area. The other thing about, of course, Invisalign cases is that it is actually fairly safe even in the current environment. I remember last year in the first round of lockdown, it was like we were dealing trays out in the car park. So you don't have to come in, just come to the driveway, and ring us, and we'll bring up the the trays for you. So it didn't stop us too much, and we were able to continue treatment. It's kind of funny. It's like drug dealing. So we took the previous breakdown and put it in a spreadsheet. Excuse me 1 second. I'm going to clear my throat with a. This is not brandy. It's tea. That's better. All right. So we put it down there, and we broke down the fee based on the minimum number of trays for each tier and the maximum number of trays. All right. So if you look at the express, and nobody would do one tray. Let's just say you do 5 trays. Even at 5 trays, each of those trays are going to break down to about $112 per tray, right? For each. Now, this is for 2 arches. And if you do 7, it drops down. So there's economy of scales here. So the next tier up, the minimum is 7. So minimum is 8, maximum is 14, so on and so forth. Single arch, double arch. Have a look at the fee, the price of the tray drop. Now, towards the end, it says 27 upwards. So I did 27 and go to 45, which is kind of an averagely big case. They can go more than that. The cost of the tray starts to drop. It starts to become feasible, right? Or fair. The cost per tray is about fair. But if we do it ourselves in-house, okay, the statistics I gave you on the minor cases here is aimed at these cases, the express and light. There are so many of these cases, but if the lab fee is this much, you cannot provide it competitively against the likes of Smile Club. Okay, they're charging what, 2004 to do a case. If the lab fee is already 2,000, forget it. You're not going to get those cases. If the lab fee is significantly less, which is what we're going to explore doing fabricating in-house, then we can provide it. Okay, so I'm suggesting that there are so many low-lying fruits, right? And we keep aiming for these ones only. They're hard work, those ones. The ones that take 2 years, 3 years to finish, 26, 30, 40, 50 trays. But the ones that take 7 trays, 14 trays, they're easy to do and very much stress-free. So if we aim at those ones, how much does it cost for me to produce one? If I print 1 tray, this is one of mine, it's not so much a guesswork. The program can work it out for you. You tell them per liter how much the resin is, and it'll tell you how much each one of those prints are. They're about 30 cents each. Okay, then we do the suck down. This is thermoplastic. Sorry, if those of you who are not in the picture yet, just bear with me. But yeah, we're jumping in the deep end here. So we do the suck down, $2.50 each. We print those models, and the suck down is then formed from the model. And I'm putting a $5 mark there for how much it costs for my staff at a time when you get good at it to cut this out and polish it. Total, that's per tray. The intangibles are, okay, we still have to have a scanner, right? We still have to buy the software, which I'm using. We have the 3D printer, and most of us already have the positive pressure thermal former. Those things I'm not going to include there because they're once off, and yeah, they're once off, and you don't have to spend it again. The consumable $780, right? Let's just say I'm wrong. Double that. That's $15 per tray. For goodness sakes, that is, you know, you don't cut yourself short and then start underpricing your trade. You can plan with the software to say, hey, this is 30 trades, say $10 each. I'm going to spend $300 with this one. How much can I charge this case for? If you start saying, you know, oh, I can still do it for $850, yeah, for 8 trades, do it. All right, so that's where the bottom line is when it comes to the dollars and cents. As you get better and better at it, it is in fact, you know, realistic, these figures. And we're standing on the precipice of a big change coming up as well, which I will tell you more about, because even this technology I'm showing you now is about to be, well, I wouldn't say superseded, but taking to the next level. And it will take it to the next level in a way that will make this, what we're showing you here, even more efficient. Okay, Kevin, I think I might stop there and take some questions, if there are any.
Feel free to ask any questions, and yeah, still no, we don't have any questions yet, but
Okay.
you can talk to, you can ask your questions directly, or you can type on the chat. Okay, and do you have any questions for up to now?
Yeah.
Okay, and
Hello.
since we
Hello,
oh yes,
yeah.
Hello.
Yeah.
we can hear you.
Just ask a quick question. Are you guys based in Australia?
Yeah,
Yes,
I'm in
that's right.
Sydney. We're in Sydney.
All right. Okay. And so I was just wondering, does any lab do these orthodontic aligners?
Yes, of course. So using the software gives you back the control, which is the key part of it, right? This is an inevitable problem for you if you start printing it in your surgery. Is that very quickly, and it'll exceed your capability of producing yourself, and then you have to either step up, scale up, or you start getting the help of a lab. And Kevin's is set up to do that. Okay, and what I would probably recommend is this, right? You do some cases and small cases, and you do whatever it takes that you can do. Use up the capacity of your surgery, because staff is not 100% being kept busy all the time. You can take this up. Okay, you take it up until your capacity is reached. Then with any excess or anytime you get busier, up and down busier, you put the excess to Kevin and say, hey, Kevin, I need 10 trays this week. Can you do this? And he will be able to provide it. What you do is you use this software and send the models across. You just say bang, 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 bang. There's no to and fro. Are you familiar with Invisalign?
No, I'm new to orthodontics in general.
All right. It's a good way to start. I think orthodontics, look, this is not a shortcut orthodontic by any means. Okay. And when I teach a course, I will go through the pre-analysis. You do have to do it properly. You know the politics out there. Yeah, the specialist is still out to chop your head off and you don't do it right. So I will protect everybody and say, okay, fine, you have to do all the pre-operative preparation. I'm just jumping the sexy bit, which is what you're looking at here. But the pre-operative stuff, you should do. I'm not saying that you need to do it for the social 4 trace cases. That's nothing. But once you get, and I would suggest to you though, do a lot of those cases, and then you'll get an appetite for the bigger cases, and that's where the full Ceph analysis, the lateral Ceph analysis, everything that you have to do to prepare to protect yourself must come in. Okay, but yes, if you don't want to get into the printing, you still, I argue, you still want to get into the of being the dentist, of controlling the tooth movements, and we'll cover that part in the theory component as well. The way I'm going to choose to present this course to you guys is problem-based. Right? We won't go into the theory and work into the problem. We'll go to the problem and work outwards to the theory. It is not that many theories in it. It's stuff that as an undergraduate, they've actually kind of thrown it past you, but then they make you too scared to use it, right? They'll say, oh yes, it's too, but it's not, it's no longer there. It's no longer like the old days I'm not sure. You look very young, so I'm not really sure what they're teaching you now. But when I was graduated from my undergraduate degree, it was teaching you enough so you can refer. That was the strategy. But technology is caught up, right? So I've done the full fixed appliance, blah, blah, blah. And fixed appliance is on the way out. Right? Fixed appliance is on the way out because even the big guns, all the big schools, orthodontic, the private ones that teach orthodontics, the POS, the EODO, I'm sure you heard of those courses before, they are going sequential aligners. The difference between them and what we're trying to start here is that we don't go to a third-party provider to interact with like Invisalign, because you're going to do that. Invisalign is the top dog there. There's clear aligners. They're all fairly similar. But the advantage of doing it yourself is you get the ultimate, the best control.
Okay, so this is similar to Invisalign in that it's digitally modified or aligned like clear aligners, but you get to do it yourself. And that's unique to everything else out there in the market at the moment.
It is clear aligners. When you do sequential aligners and you send the case and you say, I want this to be done, this to be done, somebody else does it for you. Now, that somebody else is not a dentist. I mean, they're technicians. They're you can argue they do a lot of things. They're good. And they're not technicians. And secondly, I know even from looking at my cases, it doesn't have the patient behind it. It's just the model. I know my patient. I know their bite. I know their structure. As a clinician, you know the limitations of what you can do because you know the patient. So I will argue that we will do a better job at this. Right? We will do a better job. This program also has this automatic function. If you set it up, you hit a button, it'll do the alignment for you, vroom, in one go. That's rubbish. It's a marketing tool. It can do it, but it will do it in a manner that may not be realistic, number one, and may not be achievable, number two. Okay, so for us, I moved the teeth. This case that I'm showing up now is the one that I decided to do one extraction, different extraction, and explore the case because I can. It took me 10 minutes each case, and then this way, that way, this way, that way. And also I know the patient. I'm thinking, she won't let. There's no way. I'm not. The easiest thing to do was to extract the anterior, right? Because there's a small gap. But she's a very, very, she's got a front end kind of, she meets a lot of clients. She won't go for that one. So the best I'm going to be able to do for her when I thought about it is that 4-4, extract something in the back, or the 4-7. So I'm exploring that. Okay, imagine you're going to do that exploration of what I went through here, 4-5 case scenario through a lab. It's not going to be as quick as that. It's to and froing, to and froing, to and froing. Anyway, and if you imagine that if you go to a sequential aligners, for those of you listening in now, they've done Invisalign before, it's not as if you can take a case and go, here's my case, and they go, yeah, 30 trays, finish. Really? It doesn't go that way. Occasionally, you'll go all that way. Typically, it doesn't. In which case you refine or you compromise with the patient. Oh, that's close enough. That's it. Okay, but it's kind of like saying, if you play golf, it's a par 5, and you say, I'm going to hit one, and it's going to go straight into that par 5 in one go. Very seldom. Okay, it's very seldom. It's called par 5 for a reason. You're going to bank 5 times, sometimes more, sometimes less. Okay, so when you have to do this refinement via a third party, you still have to scan, yes, but you don't have to wait 2 weeks before it comes back again. You can actually literally say, yeah, I can do this for you tomorrow. Bang, you're done. Okay, print it, bang, suck it down tomorrow, there's a tree. And that's the beauty of this. And the lag of 2 weeks really is a significant issue when I was doing this. I've done 50, 60 cases with Invisalign. I got sick of it. I mean, the lag of there's something wrong here, and then when it comes in 2 weeks, which one was that again? You forget. And one of the more logistically important things is that I'm at a stage of my career where I want to you know, I want to do things that is very much more predictable. And do you do any fix? You don't do any ortho, you said before.
I'm just like getting into it. I'm just reading up about it, like, you know, just like theory, things like that. Yeah.
Good. Good. The benchmark, of course, is fixed appliance, right? Brackets, wires, etc., etc. That is slowly going to change now. And actually, I don't think it's slowly. I think that there's a very big move towards this is among the specialists themselves as well, towards sequential aligners. And the reason simply is this: as you go into fixed appliances, as you get busier, we're not specialists. Our chairs is not just lined up for putting brackets on all the time and then one after the other. We have to do root canal therapy, a clean, a filling, and then ortho. And what I found in the when I graduated from POS 20-something years ago, he said, "Wow, excited! Let's go do lots of ortho." And as your ortho practice become busy, your afternoons are all taken up with ortho because after school the kids come in, and you're doing your ortho. You put down 20 minutes for a wire change, 10 minutes. It's really quick, right? Now things could go wrong. Take it 20 minutes. Now if they come in and they've haven't popped a bracket, it takes 10 minutes. If they pop a bracket, it'll be 20 minutes. But what happens if they pop 2 brackets, 3 brackets, 4 brackets? It becomes a problem. It became very stressful, right? As the orthodontic component of my practice built up, it became very stressful. Now, I can tell you with sequential aligners, that's not the case. It's very predictable. If they break a tray, big deal, right? Fine, I'll put you another one, or I do another cycle. So even though I am fully capable with fixed appliances, I've been doing for over 2 decades, I am switching down. I haven't wanted to, and I haven't done any fixed appliance in the last at least 12 months, right? And the logistics of keeping the control, like project controlling 30 cases of sequential aligners, that's a significant factor as well.
All right, thank you. So I guess, yeah, I'll let the other people ask their question.
Thank you. Thanks for the question, Bill. Thanks, Ian. Anybody else? There's a chat here. Let me see.
Okay. If we don't have any questions for today, and may I, Dr. I will share my screen with the other participants now. Yes. I will share my screen now, and please visit our website, cm-medical.com.au, and come to news and updates. And you will see the course detail. And next 2 weeks later, which will be 19th of October, same Tuesday, same 7 p.m. And and Dr. Ho will discuss, talk about attachment. And I guess this will be the most interesting topics. And also after that, he will cover printing and online fabrication and advanced course management. And also feel free to ask us to arrange the demo online software for you to try. And we do have demo license for you to try with the a full feature, just to open up. So you can, meanwhile, you can utilize this software to start with your cases. But also because of the busy dentist, we are able to set up cases, but also we are able to produce fabricated aligner from CNA. And also feel free to ask us to set up or try with your case. And after you get familiar with the softwares, and I guess that is the could be like kind of like approach for you to start your own aligners. But also another reason why we want to invite you to come to our workshop is because you can take a look at what tool we use and what foil we use and what positive pressure format we use, and you can copy our system to your practice And also sometimes, we are happy to accept train your nurse in our workshop, like half a day, and she will know how to cut, how to fabricate the aligners. I guess that's also a good step. And that's all for today. Thank you very much, and thank you, Dr. Ho, once again.